Cataract. Description: cataract refers to any opacity within the crystalline lens. Opacity may be acquired or congenital, focal or generalized, large or small, multiple or singular, and may affect any layer of the lens, nucleus or cortex, anterior or posterior. In a mature cataract, the whole lens is opaque, whereas a hypermature cataract is characterized by a loss of fluid from the lens, causing shrinkage and wrinkles of the anterior capsule. Finally, in more Gauguin cataract, the cortex has liquefied and the totally sclerotic nucleus sink within the capsular bag. Causes: age-related. Age-related change within the lens are the result of accumulations and compactions of lens fibers and precipitation of lens protein, particularly the alpha crystallins. There are three types of senile cataract: nucleus sclerosis leads to hardening and brunising of the nucleus. Cortical cataract result in typical white spoke-like opacity, often with associated vacuoles or water clefts. A posterior subcapsular cataract is a plaque just anterior to the posterior capsule and results from posterior migrations of equatorial lens epithelial cells. Trauma. Direct penetrating trauma of the lens usually leads to rapid cortical opacification. Rarely, this may remain isolated to the area of trauma. A blunt, non-penetrating trauma can result in anterior subcapsular opacity, typically with a flower-like appearance. Symptoms: lenticular opacity leads to a number of symptoms, the most common of which is blurry of vision. Cataract can also lead to glare, particularly with cortical opacities. Patients may also report halos around headlights, especially with night driving. Nuclear sclerotic cataract may lead to a myopic shift and may also alter color perception as it acts as a yellow filter. Management: grading of the cataract can be performed using the Wilmer Institute cataract grading system. The photograph on the left, the photograph demonstrates grade 1 to 4 nuclear sclerosis on the left and the consideration of the lens in 16 equal parts to grade cortical cataracts on the right. Advice and review. Review is appropriate when the cataract is not considered functionally or clinically significant. Consider a 12-month interval for review. Surgery. The most common indication for cataract surgery is a visual functional defect attributable to the cataract. The age, infirmity, and visual demands of the individual patient needs to be taken into account when making the decision whether to offer surgery. The most common surgical technique for cataract removal is now small incision film co-emulsification with intraocular lens implantation. This procedure is usually performed as day surgery with local anesthesia and usually results in rapid visual recovery.